How are you all? Today's topic is GERD, which means gastroesophageal reflux disease. Let's first see the overview of this disease. This GERD, gastroesophageal reflux disease, occurs when a stomach acid frequently flows back into the tube, which is esophagus, which connects from your mouth and to your stomach. This backwash, which is also called as this acid reflux, this irritates the lining of your esophagus. Many people experience this acid reflux from time to time. This gastroesophageal reflux disease, this may be a mild acid reflux that occurs at least twice a week, or moderate to severe acid reflux that occurs at least once a week. Most people can manage this discomfort of GERD with lifestyle changes and over-the-counter medications. But some people with GERD may need stronger medications and surgery to ease the symptoms. Now let's get into the symptoms part. The common signs and symptoms of GERD include: there is a severe burning sensation in your chest, which is also called as heartburn, usually after eating, which might be worse at night. And you may also experience the chest pain, difficulty in swallowing, and regurgitation of food or sour liquid, and a sensation of a lump in your throat. And if you have a nighttime acid reflux, you might also experience there will be chronic cough, laryngitis, new or worsening asthma, and there may be a disrupted sleep also. Now let's get to the causes of GERD. This GERD is caused by the frequent acid reflux. When you swallow, a circular band of muscle around the bottom of your esophagus, which is called as lower esophageal sphincter, which relaxes to allow food and liquid to flow into your stomach. Then that sphincter closes again. If that sphincter relaxes abnormally or weakens, stomach acid can flow back up into your esophagus. This constant backwash of acid irritates the lining of that esophagus, often causing it to be inflamed. Now let's see the risk factors which causes the GERD. The main risk factors include obesity and bulging of the top of your stomach up to the diaphragm, which is called as hiatal hernia, and in a pregnancy, and connective tissue disorders such as scleroderma or delayed stomach emptying. And the factors that can aggravate acid reflux that are included, those are smoking and eating large meals or eating late at night, and eating certain foods such as fatty or fried foods which triggers this acid reflux, drinking certain beverages such as alcohol and coffee, taking certain medications such as aspirin. These are the factors which aggravate the acid reflux. Now let's see the diagnosis part. Your doctor might be able to diagnose this GERD based on the physical examination and history of your signs and symptoms. To confirm a diagnosis of GERD or to check for complications, your doctor might recommend an endoscopy, which is upper endoscopy, that your doctor inserts a thin flexible tube equipped with a light and a camera, which is called as endoscope, down your throat to examine the inside of your esophagus and stomach. This test results can often be normal when the reflux is present, but an endoscope may detect inflammation of the esophagus. It's called as esophagitis or other complications. An endoscopy can also be used to collect a sample of tissue to be tested for the complications such as Barrett's esophagus. And the next one is ambulatory acid probe test. A monitor is placed in your esophagus to identify when and for how long stomach acid regurgitates there. The monitor connects to a small computer that wear around your waist or with a strap over your shoulder. The monitor might be a thin flexible tube that's threaded through your nose into your esophagus, or a clip that's placed in your esophagus during an endoscopy, and that gets passed into your stool after about 2 days. And next one is esophageal manometry. This test measures the rhythmic muscle contraction in your esophagus when you swallow. Esophageal manometry also measures the coordination and the force exerted by the muscles of your esophagus. And the last thing is X-ray of your upper digestive system. These X-ray are taken after you drink a chalky liquid that coats and fills the inside lining of your digestive tract. The coating allows your doctor to see your esophagus, stomach, and upper intestine. You may also ask to swallow a barium pill that can help diagnose a narrowing of esophagus that may interfere with your swallowing. Now let's come into the treatment part. Your doctor is likely to recommend that you first try the lifestyle modifications and over-the-counter medications. If you don't experience relief within a few weeks, your doctors might recommend prescription or medication or a surgery. These over-the-counter medications include antacids that neutralize the stomach acid and the medications which reduce the acid production, which are known as H2 receptor blockers, or that medications that block the acid production and heal the esophagus. These medications are proton pump inhibitors. And the surgery includes the fundoplication. The surgeon wraps the top of your stomach around the lower esophageal sphincter. This tightens the muscle and prevents the reflex. Now let's see some of the lifestyle modifications and home remedies. First one is maintain a healthy weight and stop smoking and elevate the head of your bed and don't lie down after a meal and eat food slowly and chew thoroughly and avoid foods and drinks that trigger acid reflux and avoid tight fitting clothes. This is all what you need to know about the GERD. Thank you for watching. If you like my video, hit that like button, subscribe to my channel and share this to your friends and family members. And I'll see you guys in my next video. Until then, bye.